The kidneys are two bean-shaped organs. Each kidney is about the size of a fist. Kidneys are one of the most important organs of the body. They help in removing the toxins from the body and keeping it fit and healthy. They also help in producing urine and controlling the levels of many elements in the blood. Kidneys also regulate blood pressure. Kidney disease means your kidneys are damaged and can't filter blood the way they should. You are at greater risk for kidney disease if you have diabetes or high blood pressure.
And I think education is lacking, so they don't understand how important it is to take your medication, continue your follow-up with your doctors as often as we ask you to come in. We're asking to do that because we know what happens if you don't, the end organ damage that can happen.
Dr. Suku describes kidney disease as a silent killer, somewhat like hypertension.
You don't know you have kidney disease unless you get a blood test or a urine test. Your kidneys will tick along until you're at end stage or very close to end stage, and then you will get the symptoms.
And the symptoms are not easily recognizable.
Because you get a little bit of fatigue, you feel very weak, you feel like you can't do tasks that you were doing before. You may get some swelling of your legs, but you may not think, is this my kidneys?
Not drinking enough water, eating processed and sugary foods, or developing chronic diseases such as diabetes, high blood pressure, and heart disease can impact the kidneys and their function.
We also want to limit processed and preserved foods, a lot of refined sugars, and that's for everyone. In terms of an age group, yes, people over 60 are more prone to having diseases such like diabetes, hypertension, and of course kidney disease. Obesity is a risk factor for kidney disease.
To detect if a person has kidney disease, doctors perform a simple blood test to look at the levels of creatinine, a waste product that comes from the digestion of protein in your food and the normal breakdown of muscle tissue. There are 5 stages of kidney failure, stage 1 being the best, and stage 5 where everyone starts to talk about dialysis and transplantation. In Trinidad and Tobago, the National Organ Transplant Unit is actively calling for citizens to sign up to be living or deceased transplant donors. Stanley Reed was diagnosed in 2008 with chronic kidney disease due to high blood pressure. Mr. Reed, a member of the Kidney Support Group of Trinidad and Tobago, underwent dialysis 3 times per week for about 1 year before his youngest son willingly agreed to be his kidney donor.
We encourage living donors, and where you can go to the National Organ Transplant Unit at Mount Hope and sign up to be a living donor. The other type that you can also sign up for is a deceased donor. In the event of one's death, then what you are doing is really allowing the organ transplant unit to be able to utilize your kidney to be able to help 1 or 2 persons who would be in need of a kidney.
The advice to prevent kidney disease: take good care of yourself, exercise, follow a nutritious diet, get your blood tested and your urine tested if you have high blood pressure or diabetes. I'm Karen Kozier-Phillip with your TTT News Health Check.